Hey, thanks for joining. Today we're going to discuss making the decision. And when I say making the decision, I mean making the decision of going forward with hip or knee replacement surgery. Now that's a very personal decision that people make. But this video will give you a little bit of food for thought on that. Some things to consider before going down the road of hip or knee replacement surgery. Stay tuned. Welcome back. I'm Dr. Dan Tomaszewski, orthopedic surgeon at the Door Orthopedic Center at Door County Medical Center. And again, we're going to discuss making the decision today. And what an important topic. Hundreds of thousands of Americans every year find themselves at that crossroads. Do I or don't I? Is this the right time to go forward with hip or knee replacement surgery? And hopefully we can give you a little bit of information about that, some things to consider before going down that road. Now, in order to really understand the decision-making process the best, I think you need to understand the underlying problem that leads so many people to needing a hip or knee replacement, and that is osteoarthritis. Osteoarthritis is the most common diagnosis that leads people to going forward with hip or knee replacement surgery. And osteoarthritis is a problem of wear and tear. It's not a building up, it's not a growing problem, it's a breaking down problem, it's a wearing away problem. And the analogy I use for people to describe what osteoarthritis is that it's kind of like tread on a tire. When you're born, you have great thick cartilage that performs very well and is very comfortable. But over the course of time, just like tread on a tire can wear off, that cartilage can wear off and leave you with a joint that doesn't perform as well, right? When you have a bald tire, it doesn't perform as well. It doesn't stop like it used to, and speed up like it used to, and maneuver like it used to. Hip and knee arthritis is just the same. Now, unfortunately, there's no way to regrow cartilage at this point in time. There's no good treatment, no medicine, not even any surgery that regrows cartilage and restores the joint to the way it used to be. And so osteoarthritis is a very definitive diagnosis, and the treatment options are very straightforward. You can either get a new tire, which is get a new hip or knee replacement surgery. That's the definitive answer. That's what gives you a new joint, a new foundation. Or you can manage with what you have. And when I say manage with what you have, there are many different treatment options that you can explore. That can be anything from weight loss, keeping weight down so that we're not putting extra stress on our joint, to physical exercise. When we have osteoarthritis, it's very common for people to scale back their activity, right? They don't go for the walks that they used to. They don't play basketball and tennis. Maybe they don't navigate stairs like they used to. That can lead to weakness and stiffness. And so therapy, exercises can really combat that weakness and stiffness that we see when we develop an arthritic joint. To braces. Sometimes a knee sleeve can be helpful to keep people more comfortable and maybe even give a little bit of confidence in the joint. To maybe even a cane or a walking stick for longer distances so that we don't worry about falling as much, so that we have better balance, so we can trust our joints a little bit better. Those are all physical treatments to help manage osteoarthritis. There are, of course, other medical treatments you can explore too, from over-the-counter remedies like salves and balms and supplements, to over-the-counter pain medications like acetaminophen or ibuprofen or naproxen. Those can all help people manage arthritis-related pain. Beyond that, you can even consider more aggressive approaches like injections. There are two different types of injections that you can use for a knee. One would be cortisone or a corticosteroid injection, which is really like a heavy-duty anti-inflammatory, like putting a whole bottle of ibuprofen right in your hip or knee. Or you could consider a gel injection, which we use on occasion for people with knee arthritis. That can help lubricate the knee a little bit better and might be good for people with more mild arthritis. But any of those treatments, from salves and balms to braces to weight loss to therapy to canes to medications and injections, all of those kind of go in one bucket, in that they're all the same. None of those treatments fix anything. They're all measures that can make you maybe a little bit more comfortable, get you a little bit more functional, get you a few more miles out of your knee or hip, but they're not fixing anything. They're not regrowing cartilage. They're not erasing arthritis. So occasionally someone will challenge me on that a little bit. They'll ask me, well, isn't that just a Band-Aid? And the answer is, well, yeah, that's a way to think about it. It's a Band-Aid. It's just giving you a little bit more comfort to get you a little bit farther down the line. Now, many times people with arthritis, even severe arthritis, just aren't ready for joint replacement surgery. Maybe their pain and dysfunction isn't that bad. Maybe they've only had symptoms for a short while. And so those conservative treatments can really help keep you comfortable while you're going through that process of making the decision. Now, fortunately, with osteoarthritis, there is rarely a time where I tell someone, it's now or never. If you don't do it now, we're not going to be able to do it in the future. And there's similarly very few times where I would ever say, oh my gosh, now we can't fix it. You've let it go too far. And so it really becomes a point where you have to decide whether or not it's the right thing for you, whether it's the right decision for you to make. It should never be another person telling you, you really have to have this done. Now, anytime we're going through joint replacement surgery, we really need to measure the risks versus the benefits. Is my problem bad enough that it's worth going through the surgery with regard to the risk and the recovery and the rehab, all that surgery entails? And when we talk about hip and knee replacement surgery, these are still major surgeries. There's still possibilities of major complications, and that can be anything from heart attacks and strokes with anesthesia, which would be very rare but possible, to issues with the parts, the mechanical parts. Does it wear out or loosen over the course of time? To issues with the surgery itself. Do you get an infection or a blood clot or damage to nerve or a blood vessel? All of those things are possible, but all very rare. But you still need to be able to measure this out. Is your problem bad enough that you're willing to take on the risks of the surgery? In addition, I talked to people about the recovery. Surgery for hip and knee replacement has a pretty protracted recovery. It's not as though you go through surgery and you're normal the next day. And so you need to be able to dedicate your life for a while to your joint replacement recovery. And that recovery involves extensive rehab. It can be a long time, lots of sessions of physical therapy and home exercises to get you back up on your feet, to get you strong, to get you the mobility that you want. And if you don't do the rehab, if you're not committed to those exercises, well, then you might be even worse off than you are now. You have to do the exercises in order to have a great outcome after surgery. And so you need to measure all those things out. Know what the risks of the surgery are. Know what the recovery is like, what the rehab is like, and measure that against the problem that you have. Now, once you do that, I think you can make a good informed decision about whether or not this is the time for you to go forward with joint replacement surgery. Of course, you may have other questions about this. How bad is my arthritis? Am I a candidate for surgery? Are there other options? If you have any questions about joint replacement surgery and the process of making the decision to go forward with joint replacement surgery, don't ever hesitate to contact us. That's what we're here for. We always love hearing from you. But until then, again, thanks for watching.